Hello, how you guys doing today? I want to share with you today some brief information about HIV and AIDS. First off, today the information we're looking at is first the definitions of HIV and AIDS, then talk about the high and low risk fluids. Next, we'll go to how is HIV transmitted, how can you possibly get it, and then what are some of the myths about the ways that you can get it, and then how do I have it? How do I know how do you know if you have it? We'll look at some of the symptoms of it. We'll look at the testing, ways you can be tested for it, and then some ways of prevention. Hopefully, maybe this information, some of it might be new, some of it might be the same, but hopefully, maybe it can help you out. So, what is HIV and AIDS? What's HIV? HIV is acronym for Human Immunodeficiency Virus. It is a virus that attacks the immune system and weakens it. AIDS. AIDS is what you get after having the HIV virus, and AIDS is an acronym for Acquired Immunodeficiency Syndrome. It's acquired because you must become infected with it. You can't be born with AIDS. And the immune system affects the immune system and breaks it down. Syndrome, because a person that has AIDS may experience a wide range of diseases and opportunistic infections. So, with that, what are some of the risky fluids that transmit it? Well, your high-risk fluids, the ones that are more able to transmit from person to person the disease, the virus, are blood, semen, vaginal secretions, and breast milk. Now your low-risk fluids, where you're least likely to catch it, are tears, sweat, urine, and saliva. Alright, so maybe you wonder, how is HIV transmitted? Well, the most common way is through unprotected sex, sharing unwashed sex toys, sharing needles, syringes, other injection equipment from the mother to a child during birth, breastfeeding, blood transfusions, or organ transplants. Now, with the blood transfusion and organ transplants, your likelihood of catching the HIV that way is very minimal because they do numerous tests before they go ahead and give someone to make sure that the blood and the organ aren't infected with any kind of disease or virus before they use it. Now, some ways that it's not transmitted, some of the myths, it's not transmitted by shaking hands, hugging, kissing, living with someone who has the virus, or using the same toilet or shower as someone who's infected. So, what are some of the symptoms and how can I know if I got the disease? Some of the symptoms are fever, severe fatigue, non-itchy rash, a sore throat, night sweats, sores, or ulcers in your mouth. Now, just because you might have some of these symptoms, that doesn't mean that you automatically have the virus, because there's other diseases and the common colds, infections that you can have, and have these symptoms, but not have the virus. Okay? So how do they test for the virus? Well, they use a cotton swab swabbed inside your mouth. They can do it by a finger prick, which is one of the rapid tests. You just prick your finger to go blood out. Or they do a Western blot test, where they take a blood sample for you, and it comes back. And if a Western blot test comes back, and it says you're positive, then good chance you have it, because it's 99.6% chance, leaving room for human error on it. But okay, so now how do we prevent this? You don't want to catch the virus. Well, abstinence is the best. Wait until you're married and only have one person. That's the best way to do it. Other ways you can help prevent it is by using condoms when you have sex, to wash your sex toys, to not share needles, I mean, you don't have to have it happen to get it by sex. You can just go in to the doctor's office and get it that way by them not using a brand new clean needle on it. So make sure you get tattoos or the doctor's office that they're using a fresh needle on you every time. And so, in conclusion today, we looked briefly at the basics of HIV. We looked at what HIV is, how it is transmitted, what some of the symptoms are, the testing, and some ways to prevent HIV. I hope this information was helpful, and if you think you might be infected or have any of the symptoms we described earlier, please go get tested and share this information with others. Thank you.